Hello, I'm Kirsten LeConte, Global Product Manager for the Logiq E9. Today we're going to be talking about tips and tricks for a successful shearwave elastography exam. The patient should be fasting 4 to 6 hours prior to the exam. Lie the patient on their back with the right arm extended above the head. This opens up the intercostal spaces. Place the probe across from the xiphoid in the intercostal space. To start the exam, place the probe intercostally. Try to avoid rib shadows, as you see here. Move the probe and get your best grayscale tissue image. Again, avoiding rib shadows and major vessels. Go into the elastography feature. When you've positioned your region of interest about 1 centimeter below, with the top of the box about 1 centimeter below the liver capsule, have the patient hold their breath. Hold your breath and initiate by pressing set and then freeze as soon as you see the shearwave image. Next step is to measure and set. Repeat this for up to 10 measurements. And again, hold your breath. You can breathe. Try to get as much tissue sampled as possible, but again, staying away from rib shadows and major vessels, even to the point where you may want to change the intercostal space. Hold your breath. Breathe. And again, hold your breath. Hold your breath. Hold your breath. And hold your breath. You can breathe. And hold your breath. Hold your breath. Breathe. 2 more to go. Hold your breath. And 1 more. Hold your breath. Breathe. At the end of the exam, go into the worksheet by pressing on the touch panel tab. And here you can take a look at a summary of the measurements that you've taken. Recommendations are to use the median and the IQR, as you see on the worksheet, with a ratio of the IQR over median being below 30% as a good quality exam. Here we have 12%, and again we have consistent measurements, so you see that this is a good quality exam. As I mentioned, the region of interest should be placed about 1 centimeter below the liver capsule. The liver capsule is stiff. Let's take a look at what happens if you're too close to the liver capsule. All right, hold your breath. Breathe. Here you can see red echoes, higher intensity artifactual echoes at the level of the liver capsule. You also notice that there's dropout, which is the internal quality factor of the color mapping for the shear wave. So again, this would be artifact due to the stiff area of the liver capsule. Let's take a look at what happens when you go too deep. And hold your breath. Breathe. You'll notice here that the beam attenuates and we have a lack of shear wave propagation. It's still possible to take a measurement in this area because you have more than 50% of the image, shear wave image, being good. You could choose to manipulate your cursors there. And don't worry about whether or not the circle is over the color mapping area, as any grayscale is not factored in to the shear wave measurement. So again, a 4.05 kPa for this particular patient is consistent with the measurements that we got before, but again, you'll notice that the beam does attenuate when you get below about 7 centimeters. Let's take a look also at what happens when you don't use enough probe pressure. Here is appropriate probe pressure. Hold your breath. You'll also notice that we have a lack of color mapping due to a vessel, but again, it doesn't affect your measurement. This would be one that we could take a measurement. Let's scan again for a good, hold your breath, using appropriate probe pressure. There we go. Perfect. Okay, now I'm going to let up on the pressure. Hold your breath. Breathe. Notice how we get a non-homogeneous area, a bit speckled, and this can be accentuated by not having enough pressure. Hold your breath. Again, with light pressure, too light pressure. Another example of a very inhomogeneous image. And let's go back to a good image with the appropriate pressure. Hold your breath. Breathe. And again, notice how homogeneous and filled in that region of interest is. Let's also take a look at what happens when you don't stay in the center of the field of view. Hold your breath. We're getting closer to rib shadows. Breathe. Again, a very inhomogeneous image with lack of color fill and quite a bit of artifact as we're up close to that liver capsule. Again, getting back to the center. Hold your breath with appropriate pressure. Breathe. A little bit close to the vessel, or to the liver capsule. But again, using our region of interest control, we can bring that region of interest down and avoid the artifacts that are at the top. And again, very consistent with our original measurements. As you go deeper, what happens as you're shooting across from intercostal into medial, you actually come into large vessels. This is what can happen from patient motion or vessel motion. Hold your breath. Breathe. You'll notice this area of streaking, particularly the red streaks. These are artifacts. You should not take a measurement in this region of interest. It is possible to perform studies on higher BMI patients. Depending on the patient condition and the scan angle, you may have to do a left lateral decube or partial decube. And if you do that, that's the way you should be repeating the studies when the patients return for their annual or semi-annual surveys. So in this situation, we're going to apply some gel and see what we get from a flat on their back situation with this particular patient. And because I don't have a great window, I am going to have the patient do a semi-oblique. So if you could turn up. And again, the patient's keeping their hand up above. That's great. So let's try this position. There we go. And again, applying enough pressure. And all right. Hold your breath right there. Hold it. Breathe. And this is a great homogeneous acquisition. So in this position, this is perfect for this patient, and we will make sure that as that patient returns, we stay in this position. You might want to put a sponge or a pillow on the behind the patient so that they're steady. But again, keeping a steady hand, a steady patient will ensure a good exam. So let's go through a couple of cases that were performed on difficult patients and talk about when do you know you've tried everything and perhaps the patient just isn't an amenable patient to having a good shearwave elastography study. In this particular case, you'll see that there are a number of things that are wrong with this acquisition. First of all, the region of interest is away from the center, should be in this area here, away from the center where you get your best signal. So being lateral to the center is a problem. Another problem here is the measurement was taken in a very inhomogeneous or what I call pixelated or mosaic pattern. This image is full of artifact. So this measurement should not have been taken. And in fact, you notice a very high measurement with 1.95 meters. Let's take a look at why this image and this patient may have been difficult. In particular, you'll notice that the patient has quite a bit of adipose prior to getting to the liver capsule. So roughly about 3 centimeters of subcutaneous fat, which makes it a difficult exam. The other problem with this exam was that the gain was increased to the maximum 100. We highly recommend that you stay at the factory default settings of between 50 and 60 for a gain setting. So what happened here was this gain setting was set artificially high, and if I decrease the gain, you'll notice to the factory default, you'll notice that we have about 50% of this image that could be measured. And when I go to that next image, you'll see that at a gain setting of 56, with a very small ROI, but still enough to get a good sample, we get a more accurate measurement and more reflective of this patient's condition with a 1.76 meters versus the 1.9. Here's another example. Again, notice quite a bit of adipose, almost 3 centimeters before getting to the liver capsule, right in through here. Again, unfortunately, you can see great grayscale imaging here, but the sample was taken away from the center of the image, and again, at a very high gain. So if we look at this image, it's one that you would not want to take. It's very much a pixelated or mosaic pattern, full of artifacts. And when we decrease the gain to our factory default of 55, you'll notice that less than 50% of that region of interest is filled in with shear wave color and mapping. So this is definitely an image that you would not want to measure. However, again, to show it is possible on higher BMI patients to get a good image when a proper ROI was placed in the center of the image. You'll notice a much more homogeneous pattern, and you will notice that here we have 80%. So again, highly recommend that you stay at the factory default setting. So as I go back and do our quality check and notice that even at 55, with the gain being at a factory default of 55, we have more than 50% of the region of interest filled in. And this would be one where you could take a very valid shear wave measurement. That concludes our shear wave elastography tips and tricks. For more information, please join us on Logic Club.